Greetings and welcome to the Global Healing Network. I'm your host, Dr. Kamal Kokai, and today I'm joined by a physician colleague in Central Florida, Dr. Jamal MacLeod. Dr. MacLeod is Director of Zenith Wellness, and this is actually an integrative medical practice in Central Florida. I invited Dr. MacLeod on because he has a unique set of skills as an integrative physician who's involved with osteopathic work, neuromuscular manipulation, and a lot of interesting laboratory work. And I thought he would be a great person to come on so that most of us, particularly here in New York, can find out what we are missing. New York is pretty restrictive with respect to different laboratory tests, and it's always good just to hear other healers' journeys so we can better understand, the whole process of medicine and healing. So, Dr. MacLeod, welcome.
Welcome.
Can you hear me well there?
Yeah, I can hear you. How you doing today?
I'm doing fine. So I like to start off, why don't you share a case that kind of highlights some of the work that you do so that people can get a better appreciation?
Okay. Well, we had a 59-year-old female. We'll just call her Jane Doe. She came in. She's seen multiple different, Western practitioners. She has a history of fibromyalgia, chronic pain, chronic fatigue, a lot of bloating with her gut, a history of fibroids. She was diagnosed with polycystic ovarian disease. And just general malaise. She just felt very, very bad, didn't have a lot of energy or zest for life, and she felt it continue to go down the drain, day after day. So when she came to see me, she had an extensive amount of lab work that was done, as you can imagine. She's seen all different types of practitioners. Nothing really got her better. They had her on steroids, all the general medication. They tried to hysterectomy. So they did a hysterectomy.
Wow.
They removed some of her fibroids over a period of time, which continued to come back. Tried many different diets from Jenny Craig, most of the mainstream diets, Weight Watchers, bad results there. Give you a little bit of a background. One of the things that I do as an osteopathic physician, we do an osteopathic structural exam. What that means is when patient comes and sees me, the first thing that I do is put my hands on them and assess them from head to toe. I see how their cranial bones are moving. I see how their sacrum's moving, so that gives me a general feel of the energy that's going throughout their body. I also can use that to look at the parasympathetics and the sympathetics, so their nervous system basically and how that works. Also can feel any muscle tensions, any strains. A lot of times if they have a strain or they have an area that's affected, a lot of the energy will vortex to that area. So it's like a black hole will be sort of in that area, and everything will pull directly to that area. So that's the first examination that I do. Gives me an overall feel for the patient, and I have an extensive history, which asks a lot of different questions from environmental toxicities, etc. She's raised in an urban city, used a lot of formaldehyde, so she spent a lot of time as a hairdresser dealing with a lot of different chemicals. So that's another bit of her background. We also asked a lot of the embryological history from the standpoint of was she a C-section, normal delivery, if she has that information. Was her mother in a lot of stress while she was carrying her? She was a C-section. She said that her mom tended to be stressed out and had a lot of low energy pathways also. So the first thing I did was a osteopathic exam. I put my hands on her head, and she had a torsion, so right torsion on osteopathic exams. That just means that the bones weren't equal from left to right. She also there's a ligament that attaches.
So you actually feel this with your hands. You're trained to actually be able. Right.
Yes, I have my hands behind her cranium, and I'm just basically feeling this. And also, her sacrum wasn't moving very well. That's the tailbone area. So her tailbone is connected through a lot of different tissue to your head. And if it's not moving very well, it tells us a lot from an energetic standpoint of the patient. Also, she had a lot of towards ovarian area in her body, and as we know, she had a history of ovarian cysts. So I did a complete structural examination. We go down the spine too, so the different vertebrae that make up the backbone. If different levels are tender, and it's called a somatic dysfunction in the osteopathic world, that basically correlates directly to organs. So it's a visceral somatic relationship. So she had a lot of ones that were out there too. She had a lot of her vertebrae that were. The next thing I do with a patient usually in this case is I look at their general labs that the other practitioners did. I look to see if there's any anemia that's there. Usually if there's any sort of anemia that's seen on the blood labs, whatever work I do until the anemia is addressed, it will reset it. So in other words, if I do structural healing through osteopathic manipulation, she won't hold the treatment. She'll reset back to her norm, which is in the state of dysfunction.
Because of the anemia.
Correct. The basic mechanism behind that is that it's the problem with hemoglobin is in the cells, the red blood cells, and that's what holds oxygen. So when a person has anemia for various different reasons, they're not able to hold a lot of energy inside of their cells. They're not able to have a lot of oxygen, which is aerobic respiration. So their cells aren't basically working very well and producing a lot of energy. The body needs energy to keep the new template that I laid down of health and healing. So she showed iron deficient anemia, which is not uncommon for someone that has fibroids. Had a history of a lot of irregular menstrual cycles, a lot of irregular bleeding. She didn't show any signs of B12 or any of the other types of anemia. Then at that point, I would usually look to see colon. Anytime you see bleeding that's there for a person that's anemic, you look to see if they have any sort of colon dysfunction, cancer, any sort of ulcerations, any other source of the bleed. The whole idea is to get to the root cause. She didn't show any of that, so basically treated her, changed a lot of dietary regimen to address her anemia. Next thing I usually look at in her case and in general is the adrenal glands. Adrenals are basically the organs that help to deal with stress. It produces a lot of different hormones. For somebody like this that has fibromyalgia and a lot of chronic diseases, their adrenal glands are usually flatlined. They're using a lot of their reserves, and after a while, they don't have the ability to rebound back. So
let me just interrupt you a second, because you've mentioned fibromyalgia a few times, and I'm sure there are many people that don't really know what that is.
Okay. It's a syndrome. So a syndrome is basically a set of, it's a diagnosis of exclusion. So that basically means that there's a lot of different things that are going on in the body. You have trigger points, which are tender areas at different parts of the body. You have a lot of fatigue. The patients usually have a lot of different pain syndromes that are going on in the body. And Western medicine has labeled it as fibromyalgia. But it basically means that there are a lot of different underlying things that are going on.
Okay. So ultimately, what were you able to do for this client?
So at this point, we did an adrenal saliva testing, and she showed that her adrenals were flatlined. One of the things that we did there to help her with that is deglycinated licorice is an excellent thing that helps to rebound the adrenals. We did that. Phosphatidylserine is something that's also very, very, very good. So we put her on some liposomal creams. Those are creams that go right into the skin, so they absorb directly through the skin. Gave her a lot of other nutrients, addressed her sleep cycle. So she was somebody that had a chronic insomnia, didn't usually go to bed at a normal time. So I usually like to get these people about starting out to get 8 hours of sleep, moving up to 10 hours of sleep if they could tolerate that. Stress, so a lot of individuals that do have fibromyalgia, this patient included, they have a lot of problems with boundaries. And when I say that, I mean they'll take on more than they can handle. So they want to help everybody. They want to be the savior of every situation. So it's getting her to back off emotionally and take time for herself to rejuvenate her own system.
That's a real formula for disease.
Exactly.
Right.
Yeah, you have to have time for yourself.
Right.
So that started to work, and we did serial testing, and we saw that her her baseline would start to normalize with that. Next thing we did is you want to address the gut. Your gut is your body's main ability to take in nutrients. It's broken when you take in foods. It's broken down in your intestines, and your ability to absorb that nutrients and get that into your cells a lot of times will dictate your level of health. So you could have somebody that, in her case, she took a lot of supplements. You know, she lived at GNC, so she was on every different thing to try to help her. She wasn't absorbing anything.
Right.
We did a testing. We did a certain lab test that looks specifically for gut dysfunction, and we saw that she had a lot of bacterial overgrowth. She had a lot of fungal overgrowth. So from that standpoint, she wasn't absorbing a lot. We also did another blood test that's more of a specialized lab that looked at her Krebs cycle, looked basically how she's breaking down her proteins, how she's breaking down fats, how she's breaking down carbohydrates. And things in her gut that she's not getting a lot of nutrients that are needed for these energy pathways to produce ATP.
So basically, for somebody that, in her case, with chronic pain, chronic fatigue, if your intestinal tract isn't functioning, then there's no way for you to keep up. If your adrenal glands are flatline, you've been so stressed out that leads to another exhausted state. And then if you're not sleeping, your body doesn't recharge. So I guess from a regular medical standpoint, the treatments are going to be really superficial in terms of pain medicine. I'm not clear if the adrenal piece would have been diagnosed, but you're going a different route here and actually trying to look at what's behind the actual energy drain. So you mentioned structurally you actually found something with her sacrum that was creating that. So I imagine you did whatever structural adjustment was necessary as an osteopath to correct that. You're cleaning up her gut, and then you're giving her things to help her adrenal metabolism, her sleep, and her overall energy metabolism. So what was the result, and how long did it take?
Well, it took about 9 months to just get her adrenals rebalanced at that point, because she was really flatlined completely. But slowly she started to have more energy. At the same time, we did a 4R program approach to her gut. So that's usually you first want to remove the harmful bacteria and fungus. So I use a lot of like Padiarco, it's a natural product, walnut extract. There's a lot of natural products that are antifungal, they're antiviral, and they're antibacterial. So we were able to find out exactly what natural products would work and eliminate a lot of the harmful pathogens from her system. Also have to change her diet. Somebody that has these harmful pathogens, they're usually on a high carbohydrate, high sugar diet. So really you have to restrict sugar almost completely from their diet for a long period of time so that the bacteria doesn't regrow back in the area. Then she had a lot of, and this correlated with some colonoscopy and some endoscopic look, which looks at the esophagus. She had some damage to the actual lumen or lining of her small intestine and her stomach. She showed an ulcer. So you could use different natural products to rebuild the walls of the intestines, and that also helps with the absorption through the intestines. And the last thing is to repopulate. So I put her on a lot of fermented foods, like kimchi, sauerkraut. We put her on kombucha. Taught her how to make kombucha, so she was making her own. Kombucha basically is you take like a black tea or a green tea, and you're able to ferment it with the natural sugars. So you have natural sugars that you add to that tea. The good bacteria that's there consumes those sugars, and it kind of ferments it, similar to what a wine does. So it's able to have a massive effect, much better than taking a pill form of a probiotic in terms of repopulating and rebuilding the gut.
So that's basically you're using foods as well. So you're using supplements, you're using foods, and I'm curious, what was her reaction to this whole process? Because this is kind of totally different, and you go to the doctor, you do some tests, and you get a pill, or surgery is recommended. Because you're actually talking about her changing her emotional style, changing what she's eating, changing her whole lifestyle as a way to get healthy.
Mm-hmm. It was a long road. At first, there was some restriction there, and she had an addiction to food. She's used to have, similar to mostly everybody, we're used to the standard westernized diet. So that was the hardest thing, is to get her to eliminate the sugar slowly from her diet. But as she started to lose weight and started to feel better, she really got into it and was asking me, "Oh, what could I do next?" And she really took the bull by the horns.
Well, this kind of gives a snapshot into what's actually really a problem with the whole American lifestyle, because probably all of us have different aspects of this problem, from reaction to stress, the structural pieces, the dietary pieces, and there really aren't that many practitioners, particularly doctors, that are willing or even able to take the time with patients and actually steer them in this direction. How did you get this kind of training that really allowed you to take this kind of approach as a physician? Because many physicians get caught up in just the whole process of being a physician, and they don't step out of that to actually address what's really going on with people.
Well, a lot of it was a personal journey. I've been someone that's tried to be as healthy and also implement a lot of things in my personal life and with my family, but also different training, taking different continued medical education, being a part of certain groups like dealing with age management, and also dealing with integrative medicine. I'm a diplomat and certified in integrative medicine, and that basically looks at everything from all over that is quality medicine and is backed by studies, and it basically looks at it from a holistic standpoint and holistic healing and getting to the root cause of what's going on. Because if Western medicine in general just usually treats the symptoms, and medications is one of the things that does that. It's like putting a Band-Aid on a gaping wound. So my main approach is to get to the root cause, or try to.
And you're down in Central Florida. I mean, how are other doctors responding to your work, and just people in general?
Yeah, it's a good community of healers and people that are like-minded, and it's a process. But slowly, as some of the more mainstream doctors that aren't getting results with these patients reluctantly send them to you, and you're able to get results, then some of them are more open and they want to learn. At least, like, wow, how'd you do that? So it's a gradual process, but it's happening.
And are you doing any, for people that aren't in Florida, are you doing any kind of telemedicine or other types of consults?
Yes, doing telemedicine consults. You're mainly looking at New York area right now, but yeah, looking to branch out with telemedicine and talking to other clients. Also, clients, as long as they come to my home base of Florida and see me once a year, I'm able to see clients that live elsewhere. That's
excellent. Well, Dr. MacLeod, I want to thank you for sharing your brand of integrative medicine. You're bringing your whole personal self-mastery to it, and I really appreciate the work that you're doing, and I'm sure people listening do as well. So can you just share your email address and a phone number if people want to reach you?
Email address would be my name, so JAMAALMCLEOD@me.com, and a phone number would be 407-341-6556.
And again, thank you for joining us, Dr. MacLeod. I'm sure we will be talking and doing some more work.
All right. Thanks for having me.
Take care, man.
Bye-bye.